Metabolic syndrome is a cluster of metabolic risk factors that come together in a single individual. Now, an association between certain metabolic disorders and cardiovascular disease has been known since the 1940s. Joining us this morning to give us a lesson on what to be on the lookout for is Jen Ogden, who's Bariatric Program Manager at Sandoval Regional Medical Center. Jen, thank you for coming in. I gotta say, until today, I was not familiar with the phrase metabolic syndrome. So can you tell us what that means exactly?
Sure. Metabolic syndrome is really the name for a group of risk factors that raises a person's risk for heart disease and other health problems like diabetes and stroke.
Okay. So what is the difference between, because we hear this a lot, you know, the risk factors of obesity, but what's the difference specifically with obesity and metabolic syndrome?
Well, it's a good question. Obesity doesn't necessarily relate to having some of the other risk factors. Just like a patient with a healthier BMI that is not considered obese may have some of those other risk factors.
Right. So, you know, like for example, if someone may not be obese, but they have a history of diabetes in their family, that could kind of fall under that. Is that correct?
Yeah, there's 5 key risk factors for metabolic syndrome. The first would be a large waistline or excess fat in the stomach area. The second would be a high level of triglycerides in the blood. The third is a low level of HDL cholesterol, or the good cholesterol.
The good cholesterol, okay.
A fourth would be high blood pressure, and the fifth would be a fasting blood sugar that is high.
Really?
So having 3 out of those 5 risk factors kind of puts a person under that umbrella of having metabolic syndrome.
Okay. Now, if we're concerned about this, what are some of the symptoms that we should be looking for if we're experiencing certain things that we might be at risk for metabolic syndrome?
Well, a lot of things like high blood pressure do not have signs or symptoms necessarily, or symptoms. Having a primary care provider that you see on a regular basis helps us track some of those risk factors. Having your blood work done regularly to check for the bad cholesterol versus the good cholesterol, checking your blood pressure regularly, helping manage some of those risk factors is the first step.
Gotcha. And you guys do bariatric surgery, and you were saying that's one of the most effective ways to treat this. You can get people out in as little as 2 days?
Absolutely. With our stapled procedures such as the gastric bypass or the gastric sleeve, oftentimes those patients will go home after spending only 2 nights in the hospital, and many of them will be off of their hypertension or high blood pressure medications or their diabetes medications.
That is incredible. Wow. So thank you so much for coming in, first of all, folks.
Absolutely.
For more information on this, we will have links to UNMH on our website at casa.com under the Style tab. I believe now